What if one of the biggest health mistakes after the age of 65 isn't skipping a medical test, but getting the wrong one? Many people believe that more testing automatically means better health. It sounds logical, but modern medicine has shown that unnecessary screenings and checkups can sometimes lead to stress, false alarms, unnecessary treatments, and even complications. Today's discussion isn't about avoiding healthcare or ignoring your doctor. It's about understanding that every medical test should have a clear purpose. As we grow older, healthcare becomes more personal, and what benefits one person may not benefit another. In this video, we'll explore 5 medical checkups that are often unnecessary for many adults over 65 under certain circumstances, according to current medical thinking. These are general educational points, not personal medical advice, and decisions should always be made together with your healthcare provider. Let's begin. One of the medical checkups I would think carefully about after the age of 65 is a routine full-body CT scan, when there are no symptoms, no specific health concerns, and no recommendation from a healthcare professional. At first glance, this type of scan sounds like an excellent idea. After all, many people believe that if technology can look inside the entire body, it should be able to find diseases before they become serious. While that may sound reassuring, medicine doesn't always work that way. In fact, for healthy adults who are feeling well, a full-body CT scan often raises more questions than it answers. The biggest issue is that these scans are extremely sensitive. They can detect tiny spots, harmless cysts, small nodules, and normal age-related changes that may never cause any health problems. These findings are often called incidental findings, because they are discovered by accident while looking for something else. The challenge is that once these unexpected findings appear on a scan, they usually cannot be ignored. Doctors may recommend additional imaging, blood tests, specialist consultations, or even biopsies to determine whether the finding is truly dangerous. In many cases, the final result shows that there was never anything serious to worry about in the first place. However, by that point, the person may have spent weeks or even months dealing with unnecessary appointments, anxiety, and medical expenses. Another important consideration is radiation exposure. A CT scan uses significantly more radiation than a standard X-ray. While one scan alone is unlikely to cause harm, repeated scans over time can increase cumulative radiation exposure. For this reason, medical professionals generally recommend using CT imaging only when the expected benefit clearly outweighs the potential risks. Every medical test should answer an important clinical question, not simply satisfy curiosity. There is also the emotional impact to consider. Imagine receiving a report that mentions a small abnormality or a tiny shadow, without knowing whether it is meaningful. Even if the finding later proves to be harmless, many people experience sleepless nights, worry, and stress while waiting for follow-up results. That emotional burden is real and should not be underestimated. Instead of relying on a full-body scan to stay healthy, most healthcare providers encourage focusing on proven preventive care. Regular medical checkups, monitoring blood pressure, cholesterol, blood sugar, maintaining a healthy weight, staying physically active, eating a balanced diet, getting recommended vaccinations, and completing age-appropriate screenings based on your personal medical history are all supported by strong scientific evidence. These approaches have consistently shown greater value in protecting long-term health than performing broad imaging tests without a medical reason. It's important to understand that this does not mean CT scans are bad or unnecessary. They are incredibly valuable tools when someone has symptoms such as unexplained pain, significant weight loss, persistent coughing, injuries, or when a physician needs detailed imaging to diagnose or monitor a known condition. In those situations, the benefits of the scan can far outweigh the risks. The key takeaway is simple. After the age of 65, the goal is not to undergo every available medical test, but to receive the right test for the right reason at the right time. Healthcare is most effective when it is personalized, evidence-based, and guided by your symptoms, risk factors, and conversations with your healthcare provider. Smart medical decisions are not measured by the number of tests performed. They are measured by how much they truly improve your health and quality of life. Another medical checkup that deserves careful consideration after the age of 65 is having a PSA blood test every single year, without discussing whether it is truly necessary. The PSA test, which stands for prostate-specific antigen, measures the level of a protein produced by the prostate gland. It can be a valuable tool in certain situations because elevated PSA levels may be associated with prostate cancer, an enlarged prostate, or even temporary inflammation or infection. However, an important fact that many people don't realize is that a higher PSA result does not automatically mean cancer, and a normal result does not completely rule it out either. This is why the test is most useful when it is interpreted alongside a person's age, symptoms, family history, overall health, and other medical findings. As men grow older, changes in the prostate become increasingly common. In fact, many men over the age of 65 develop benign enlargement of the prostate as a normal part of aging. This enlargement can naturally increase PSA levels without indicating a dangerous condition. Infections, recent medical procedures, certain medications, or even vigorous physical activity can also temporarily affect PSA results. Because of these factors, relying on a single blood test without considering the bigger picture may lead to confusion rather than clarity. One of the biggest concerns with routine yearly PSA testing for every older man is the possibility of finding slow-growing prostate cancers that may never become life-threatening. Medical research has shown that some prostate cancers grow so slowly that they remain harmless throughout a person's lifetime. In these cases, detecting the cancer may not improve life expectancy, but it can begin a chain of additional testing and treatment that carries its own risks. An abnormal PSA result often leads to repeat blood tests, advanced imaging, or a prostate biopsy. While these procedures are important when medically indicated, they are not without potential complications. Biopsies, for example, can occasionally lead to bleeding, discomfort, infection, or temporary urinary problems. If cancer is eventually diagnosed, many men immediately feel that treatment is the only option. However, treatments such as surgery or radiation therapy can sometimes result in long-term side effects, including urinary leakage, bowel changes, or sexual dysfunction. For men with aggressive prostate cancer, these treatments can be life-saving and absolutely appropriate. But for men with very slow-growing cancers, immediate treatment may not always provide additional benefit. In some situations, healthcare providers may recommend a carefully monitored approach, known as active surveillance, where the cancer is observed over time through regular checkups and testing, instead of rushing into treatment. This does not mean the PSA test should be avoided altogether. On the contrary, it remains an important screening tool for many individuals, particularly those with a strong family history of prostate cancer, certain inherited genetic conditions, or other factors that increase their risk. Men who develop symptoms such as difficulty urinating, blood in the urine, persistent bone pain, or unexplained weight loss should also seek prompt medical evaluation, rather than assuming everything is normal. The most important message is that PSA screening should never become an automatic yearly routine, simply because someone has reached a certain birthday. The best healthcare decisions are based on individual circumstances, not a one-size-fits-all schedule. A thoughtful conversation with a healthcare professional can help weigh the potential benefits and possible drawbacks of testing, taking into account personal values, current health, life expectancy, and medical history. After the age of 65, the goal is not to undergo every available screening test, but to choose the ones that are most likely to provide meaningful health benefits while avoiding unnecessary procedures and anxiety. Personalized care, informed decision-making, and open communication with your healthcare provider remain the foundation of smart and effective preventive healthcare. Another medical checkup that often deserves a second thought after the age of 65 is an annual cardiac stress test when there are no symptoms suggesting heart disease. Many people request this test because they believe it provides reassurance that their heart is healthy. It's understandable to think that a yearly heart check would automatically prevent future problems. However, Medical evidence has shown that for people who feel well, remain physically active, and have no warning signs of heart disease, routinely performing a stress test does not necessarily improve health outcomes or reduce the risk of heart attacks. A cardiac stress test is designed to evaluate how well the heart performs when it is working harder than usual. During the test, a person typically walks on a treadmill or pedals a stationary bicycle while their heart rhythm, blood pressure, and sometimes imaging of the heart are monitored. If someone cannot exercise, medications may be used to temporarily increase the heart's workload. These tests are extremely valuable when a person has symptoms such as chest discomfort during activity, unexplained shortness of breath, dizziness, fainting, or when a healthcare provider suspects reduced blood flow to the heart. In those situations, the information gained from the test can help guide diagnosis and treatment. The situation is very different when someone has no symptoms at all. In healthy individuals, a routine stress test can sometimes produce what is known as a false positive result. This means the test suggests there might be a problem, even though the heart is actually functioning normally. While that may seem like a minor issue, false positive findings often lead to additional testing. A person may be referred for advanced imaging, such as a nuclear stress test or coronary CT scan, and in some cases even an invasive coronary angiogram. Although these procedures can be appropriate when medically indicated, they carry their own potential risks, including exposure to radiation, reactions to contrast dye, bleeding, or other complications. Sometimes, after completing all of these additional evaluations, the final conclusion is that there was no significant heart disease in the first place. Another important point is that a normal stress test should never be viewed as a guarantee that someone is protected from future heart disease. Heart health depends on many factors that change over time. A person can have a normal stress test today and still develop cardiovascular disease years later if important risk factors are not addressed. This is why preventive healthcare focuses much more on managing long-term risk than on performing routine testing without a clear reason. For many adults over 65, some of the most effective ways to protect the heart are surprisingly simple. Keeping blood pressure within the recommended range, controlling cholesterol levels, managing diabetes if it is present, avoiding tobacco products, maintaining a healthy body weight, eating a balanced diet rich in fruits, vegetables, whole grains, and lean protein, staying physically active, getting adequate sleep, and taking prescribed medications as directed all have strong scientific evidence supporting their benefits. These habits consistently reduce the risk of heart attack, stroke, and other cardiovascular complications far more effectively than undergoing unnecessary testing. It is also important to pay attention to changes in your body. New chest pain, pressure that spreads to the arm or jaw, unusual fatigue, persistent shortness of breath, fainting episodes, or a noticeable decline in exercise tolerance should never be ignored. These symptoms deserve prompt medical evaluation because they may indicate an underlying heart condition that requires investigation. In these circumstances, a stress test may become an essential part of the diagnostic process. The key message is not that stress tests are unhelpful. On the contrary, they remain one of the most valuable diagnostic tools in cardiology when used for the right patient at the right time. The concern is with performing them automatically every year simply because someone has reached a certain age, even when there are no symptoms or medical reasons to justify the test. After the age of 65, healthcare should become increasingly personalized. Decisions about heart testing should be based on individual symptoms, medical history, existing risk factors, and professional clinical judgment, rather than routine habit. Choosing evidence-based care instead of unnecessary testing helps reduce anxiety, avoids avoidable procedures, and allows attention to remain focused on the lifestyle choices and preventive measures that truly make the greatest difference in maintaining a healthy heart for years to come. Another medical checkup that is often performed more frequently than necessary after the age of 65 is the bone density scan, especially when previous results have been normal or have remained stable for several years. Bone density testing, commonly known as a DEXA scan, is an excellent tool for evaluating bone strength and estimating the risk of osteoporosis, a condition in which bones gradually become thinner and more fragile. Osteoporosis can increase the likelihood of fractures, particularly in the hips, spine, and wrists, making early detection an important part of preventive healthcare. However, one of the most common misconceptions is that repeating this scan every year automatically provides better protection. In reality, for many older adults whose bone health has remained unchanged, frequent testing often adds very little useful information. Bone tissue changes slowly over time. Unlike blood sugar or blood pressure, which can change within days or weeks, bone density usually changes gradually over several years. This means that if a person's previous scan showed normal bone density or only mild bone loss, repeating the test every 12 months may not reveal any meaningful difference. Instead, it may simply confirm what is already known without changing the treatment plan or improving long-term health outcomes. Healthcare providers typically determine how often a bone density scan should be repeated by considering several important factors. These include age, previous scan results, family history of osteoporosis, history of fractures, use of medications such as long-term corticosteroids, existing medical conditions that affect bone health, and whether the person has already been diagnosed with osteoporosis or is receiving treatment for it. Someone with severe osteoporosis or a high risk of fractures may benefit from more frequent monitoring to evaluate how well treatment is working. On the other hand, an individual whose previous scans have remained stable and who has no major changes in health may safely wait several years before repeating the examination. Another important point to understand is that bone density is only one piece of the overall picture. A scan can estimate bone strength, but it cannot predict every fall or every fracture. Many fractures occur not only because bones become weaker, but also because of balance problems, reduced muscle strength, poor vision, unsafe home environments, or medications that increase the risk of falling. This is why preventing fractures involves much more than simply scheduling regular scans. Maintaining healthy bones depends heavily on daily lifestyle habits. Regular weight-bearing exercises such as walking, light resistance training, climbing stairs, or gentle strength exercises help stimulate the bones and muscles. Adequate intake of calcium and vitamin D, either through food or supplements when recommended by a healthcare provider, also supports bone health. Avoiding smoking, limiting excessive alcohol consumption, maintaining a balanced diet, and staying physically active contributes significantly to preserving bone strength as we age. Equally important are measures that reduce the risk of falls, such as improving home lighting, removing loose rugs, wearing supportive footwear, having regular vision checkups, and practicing exercises that improve balance and coordination. For individuals who have already been diagnosed with osteoporosis, prescribed medications can also play a vital role in reducing fracture risk. In these situations, follow-up bone density testing may be appropriate after enough time has passed to determine whether the treatment is working effectively. Even then, healthcare professionals usually recommend repeating the scan at intervals that are long enough to detect meaningful changes rather than testing too frequently. It is also worth remembering that a normal bone density scan should never create a false sense of security. Healthy bones today do not guarantee that bone health will remain unchanged forever. Continuing healthy lifestyle habits and attending routine medical appointments remain essential because bone health is influenced by aging, nutrition, physical activity, hormonal changes, chronic illnesses, and certain medications throughout life. The key message is not that bone density scans should be avoided. They are valuable, evidence-based tests that have helped identify osteoporosis early and prevent countless fractures. The important lesson is that repeating them every year without a medical reason is often unnecessary for many adults over 65 whose previous results have remained stable. The most effective healthcare focuses on using the right test at the right interval while paying equal attention to exercise, nutrition, fall prevention, and overall wellness. Personalized care, guided by individual risk factors and professional medical advice, provides far greater benefits than simply repeating tests on a fixed schedule. The final medical checkup that should be approached thoughtfully after the age of 65 is continuing routine colon cancer screening when it may no longer provide meaningful benefits. Colon cancer screening has been one of the greatest success stories in preventive medicine. It has helped detect precancerous growths, identify cancer at earlier stages, and save countless lives over the years. However, an important principle in modern healthcare is that every screening test should be appropriate for the individual's age, overall health, and life expectancy. As people grow older, the balance between the benefits and the potential risks of continued screening begins to change, which is why this decision should always be personalized rather than automatic. Many people assume that if a screening test has been helpful throughout adulthood, it should simply continue forever. While this belief is understandable, medical experts recognize that screening is most effective when a person is healthy enough to benefit from finding and treating a disease early. Colon cancer usually develops slowly over many years. For someone who has had consistently normal screening results, no personal history of colon polyps, no strong family history of colorectal cancer, and no new digestive symptoms, the likelihood of discovering a dangerous new problem may be relatively low. At the same time, the procedures used for screening may carry increasing risks as a person ages. The most well-known screening procedure is a colonoscopy. During this examination, a flexible camera is used to inspect the inside of the large intestine and remove suspicious polyps if they are found. Colonoscopy is a highly effective test and remains the preferred option for many people. However, like every medical procedure, it is not completely risk-free. The preparation can be physically demanding, particularly for older adults who may become dehydrated or experience changes in electrolyte balance. The procedure itself usually requires sedation, and while complications are uncommon, there is a small possibility of bleeding, infection, or injury to the wall of the intestine. These risks remain low, but they become more relevant when the expected benefit of continued screening becomes smaller. This does not mean that everyone over the age of 65 should stop colon cancer screening. In fact, many healthy older adults continue to benefit from it, especially if they have never been screened before, have a history of colon polyps, have inflammatory bowel disease, or have close relatives who have been diagnosed with colorectal cancer. Individuals who develop symptoms such as persistent rectal bleeding, unexplained iron deficiency anemia, ongoing changes in bowel habits, severe abdominal pain, or unexplained weight loss should seek prompt medical evaluation regardless of age. These symptoms are not considered routine screening. They are reasons for diagnostic testing and should never be ignored. Healthcare providers also consider many other factors before recommending whether screening should continue. Overall physical health, chronic medical conditions, current medications, mobility, cognitive function, previous screening history, and estimated life expectancy all play an important role. A healthy and active older adult may still benefit from screening, while another person with multiple serious health conditions may gain very little advantage from continuing routine procedures. This individualized approach allows medical care to focus on interventions that are most likely to improve both longevity and quality of life. It is equally important to remember that protecting colon health involves more than screening alone. Eating a diet rich in vegetables, fruits, whole grains, and fiber, staying physically active, maintaining a healthy body weight, limiting processed meats, avoiding tobacco products, and reducing excessive alcohol intake are all lifestyle habits that support digestive health and may help lower the risk of colorectal disease. Routine medical visits also provide an opportunity to discuss any new digestive symptoms before they become more serious. The central message is not that colon cancer screening should be avoided after a certain birthday. Rather, it should not continue simply because it has always been part of a routine schedule. The decision should be based on careful discussion between the individual and their healthcare provider, taking into account personal risk factors, previous test results, current health status, and the potential benefits and risks of additional screening. After the age of 65, the most effective healthcare is not about completing every available test. It is about choosing the tests that are most likely to provide real value while avoiding procedures that may no longer improve health outcomes. Personalized, evidence-based care remains the best approach for maintaining both health and quality of life in the years ahead. Growing older doesn't mean getting every possible medical test. It means getting the right care at the right time. The smartest healthcare decisions are based on your personal health history, symptoms, risk factors, and conversations with qualified medical professionals. Not fear or the belief that more testing is always better. Remember, preventive healthcare is still incredibly important. Regular medical visits, recommended vaccinations, staying physically active, eating a balanced diet, getting enough sleep, and managing chronic conditions remain some of the most effective ways to protect your health after 65. If you found this educational discussion helpful, consider sharing it with someone who may benefit from learning about informed healthcare decisions. Stay informed, stay active, and continue making choices that support a healthier, more confident future. Thank you for watching, and take good care of yourself.